So I do vitrectomy surgery and uveitis. I think it is a challenging patients. It is dealing with patients who have sick eyes and chronic diseases, and being able to provide care for them throughout the duration of their disease, and continue to try to come up with newer tools to reduce the treatment burden and improve their vision outcomes.
Well, the a little anxiety from the virus was definitely bothering me for a while. It still does. I feel like, at least in the northeast part of the country where I currently am, it's starting to settle down. We still see effects of it, and I think the thing that we have to realize is that we're actually adapting to the new normal, and there's not going to be any return to what we previously conceived of normal. So when we have meetings like the ASRS virtually, I actually think it was a great idea. We had a higher attendance. At one point, there was over 1,000 people logged on participating in the meeting, which is a higher attendance than any other ASRS meeting in history. With the Academy meeting planning to be virtual this year, I think we're going to have an equally higher attendance than we've ever seen before. And it really is nice. And some people may say, well, I like, travel and see the sights and bring my kids to, Las Vegas. But, the bottom line is it's safer, it's more economical. We can have a higher participation rate with still having a quality meeting. And like I said, most important thing is it's safer. So, we may get through the virus if and when a vaccine is available. But I think these troubling times are going to teach us that virtual meetings can actually, there's an upside to them, both increased participation, it's more economical. And it's not always as fun to sit at home than it is to walk along the strip of Las Vegas, but I don't know, sometimes it's just easier. You don't have to travel or take a red eye back. I think we're going to develop it into a hybrid society where a lot of things become virtual that we never imagined they would be before.
That's a hard question. For me, right now, a lot of the things that I think keep many of us up is really still COVID related. And what is the long-term consequence of that for our patients, for our country, for the field. And I think that there's a lot of encouraging things that we're seeing within our practices. We're still seeing our patients. We're still able to take care of them. But, it's had a huge impact, for example, in clinical research and clinical trials, and how those had to be paused. But I think we'll push through that. But I think that's certainly probably the top of mind, right now. I love the field that I work in. I love, retina, and I think that it's a very exciting and dynamic field. And we're in a really great place in terms of the therapies that we have for patients, but also when we look at the next chapter of, emerging therapeutics and emerging diagnostics, where we're going to be able to take care of our patients in an even more personalized way as AI becomes more of a role in what we do and potentially how we practice as well.